Lyme disease is real, and it's on the rise in Canada.
Cases of Lyme disease appear to be on the rise.
Cases of Lyme disease are rising in Canada.
But there seems to be a lot of fear and confusion around it. Even more so as celebrity after celebrity claims to have it.
There's kind of this obligation that, like, if Justin Timberlake reports that he has Lyme disease, every single media outlet is going to report on it.
Pop star Justin Timberlake has revealed that he has been diagnosed with Lyme disease.
And so then this creates this perception that, like, oh, if Justin Timberlake got it, then that means that we're all at risk.
But are we really all at risk? And should you be worried?
For a lot of people, I think they might be carrying more anxiety about Lyme disease than they really need to.
As a senior health reporter for over a decade, I've covered Lyme disease. But as these celebrity cases kept popping up, I started digging deeper into it and discovered a sort of parallel reality of testing, diagnosis, and treatments, not based on science.
I think a lot of people get drawn into pseudoscience and these sorts of fake diagnoses because they feel dismissed.
We're going to get into that more in a minute, and we're not just talking about celebrities here. There are a lot of people making a lot of claims about Lyme disease, so let's break it down. Lyme disease is an infection transmitted through the bite of a blacklegged tick, but keep in mind, not all bites lead to Lyme.
If you get bitten by a tick and you pull it off within 24 hours, there's an almost 0% chance that you would get Lyme disease, even if that tick was carrying the bacteria.
Symptoms of the disease can include a bullseye rash, fever, fatigue, muscle and joint aches. Early antibiotic treatment cures the majority of people, and experts say in known risk areas, early Lyme can be straightforward to diagnose.
The clinical diagnosis of early-stage Lyme disease is pretty reliable, and if you have a really classic picture, you don't necessarily even have to do testing to get treatment.
Cases are rising in Canada. In 2024, there were about 5,700 reported cases of Lyme disease. Most were concentrated in Nova Scotia, Ontario, and Quebec. So we wanted to know, what are the case numbers like in California that's home to so many celebrities?
Likelihood or the presumption that there's a lot of Lyme disease there is just not supported by surveillance data. So, for example, California as a state has less than 1% of the nation's, the US, cases of Lyme disease.
Now, you might be thinking celebrities travel a lot. Maybe they picked up Lyme in a known risk area, and that is possible. But when you take a closer look, it's pretty clear that most of them are talking about something called chronic Lyme disease. It's a belief that the bacteria that causes Lyme stays in a person's system, needing constant, costly treatment. However, it's not supported by science or recognized by mainstream medicine.
Many of us that study Lyme disease don't think after initial antibiotic treatment that there is still bacteria harbored there that would respond to antibiotics.
That point is key to understand because the so-called chronic Lyme industry profits from the opposite belief, selling costly, unproven treatments that can carry serious threats to your health.
People are getting taken advantage of. Like they really are. There's a whole industry around chronic Lyme disease, and people are feeding that industry with their time and their energy and their money and their hopes.
Experts stress that for most people, early Lyme is very treatable. So why then is there so much talk about so-called chronic Lyme, and what's behind it all? Well, there's a number of reasons, but let's start with testing. Testing for Lyme disease in Canada is a two-step process done through licensed and accredited public health labs. Testing can only detect antibodies built to fight the Lyme bacteria, not the disease itself. The tests are reliable, but they're not perfect.
It becomes a struggle where we don't have a clear black and white test that says, do you have Lyme disease or not?
Yet private labs promise conclusive Lyme test results, often for people with no known tick bite or exposure. And experts say those unvalidated tests are not reliable.
They claim that they're providing you a more accurate, a more sensitive test for Lyme disease. They advertise urine-based tests, which are just wholly inappropriate. You would never diagnose Lyme disease using a urine-based test.
In fact, Love called out model Bella Hadid when she reportedly posted a urine test as proof of Lyme to her millions of followers. And make no mistake, people are making big money off these tests. By some estimates, the market is worth over $15 billion US and growing. So why is there so much demand?
I think there's been an intense desire to have a simple explanation for why people feel unwell. And there's definitely people that feel unwell which have medically unexplained symptoms.
Now, it seems like we all know someone suffering with some kind of chronic illness. You might be yourself. And there are people in pain with symptoms they can't get answers for. So let's stop for a moment and be very clear here. That suffering is real. People often report feeling dismissed by the healthcare system, and they need and deserve help. That is not being questioned here. But people also need to know that private testing carries serious risk. Research shows illnesses like Parkinson's and cancer can be missed if people think they have Lyme. And consider this study. It looked at almost 1,300 patients with suspected Lyme disease. The results were striking. 84% of them did not have Lyme. Instead, researchers discovered nearly 140 other conditions that were responsible for the patient's symptoms, some of which are treatable. And that's why a private Lyme test result can be so harmful.
And so if you get a positive test, people might think that, oh, finally I have an answer for my health issues, and might go all in on any recommended therapies. But, the problem with that is if you're relying on a unvalidated test, you might be getting treatment that you don't need for a condition that you don't have.
Treatment for early Lyme disease can be pretty simple. Antibiotics taken for 2 to 4 weeks works for most people. Now, it is important to note here, untreated Lyme can spread to the joints, the heart, and the nervous system. And it's rare, but some people continue to have debilitating symptoms months after treatment for confirmed Lyme disease. Doctors call that post-treatment Lyme disease syndrome, and to date, there's no cure for it.
I've spent about $20,000 on Lyme treatment, so here's everything that I've learned.
Let's go get some biopuncture.
SOT's got a lot of buzz in the Lyme disease and chronic Lyme disease treatment world right now.
But alternative unproven treatments for so-called chronic Lyme are proliferating. These can include herbs and supplements, IV therapy, ozone, blood, irradiation, and much more. Long-term antibiotics are often used, despite the fact that research shows prolonged antibiotic use doesn't improve lingering Lyme symptoms and can carry serious risks. Our investigation into Lyme disease revealed over and over again calls for more research into chronic illnesses. Patients are suffering, and many say they're being ignored by our medical system. While doctors are empathetic, they say evidence needs to lead the way here. And everyone, including us in the media, needs to be more critical when it comes to talking about Lyme disease and what it is and what it isn't.
We can't merely platform people because they're famous. We have to be more responsible about it. And unfortunately, we live in this ecosystem where celebrity and notoriety is now conflated with credibility or expertise, and that is leading to a lot of harms.